Well, hello and welcome. It is busy working in the pharmacy, so I am streaming by myself in Sioux Falls, South Dakota, and I am super excited to have you watching and viewing today. And I'm also super excited to have Dean Jargo on our podcast today. He is the CEO of Fair Market Healthcare, and we are going to learn about how there is a free market going on in healthcare where you get to search for prices and services yourself as a consumer or an employer that might be paying for an employee's healthcare. So I'm super excited to have him on. You don't want to miss out to the very end because he's going to talk about how you can be responsible and for changing your own healthcare, where, as our goal always is here, we want to educate and empower people to take charge of their own health. And Dean is going to help us show us how today. So, Dean, welcome to our show.
Thanks, Shawn. Great to be here.
Yeah. So, tell us a little bit of history about yourself.
Well, I actually don't have a healthcare background. I worked for many years in public accounting. I actually did have a few hospitals that were clients of mine down in the Southwest. I was spent some time in Phoenix, Arizona, and so worked on a couple of hospital clients and understood fairly quickly how complicated healthcare can be based on all the third-party payers involved in the system. So I did have some exposure, but I would be I'm not an expert by any stretch. I've spent most of my career working in finance and mergers and acquisitions and across a whole host of industries, and healthcare I wouldn't say was really one of my areas of expertise. And some might say that's a negative. I actually look at it generally as a positive. Means I come in and I get to ask a lot of questions because I'm not an expert. So every day is a new learning day for me.
Well, I kind of like that idea too, because you're kind of an outsider looking in because you're not an expert in healthcare, and healthcare is like no other industry. So as an outsider, you're going to be asking these questions like, well, why is the price 5 times higher for the same service right across town? Right? I mean, that's a great question. That would never happen in the auto industry. The same car is not going to be 5 times more expensive across town. So tell us, there was probably the final straw that says, you know what, I got to do something. What tipped you off? What was the final straw that made you want to get into transparent pricing in healthcare?
Yeah, great question. The business Fair Market Health was actually started by a couple of local doctors, and their original plan with the business was they were going to go replicate what Dr. Keith Smith built down in Oklahoma City with the Surgery Center of Oklahoma, which I'm sure some of your guests are probably familiar with. And so the idea with these 2 Wichita doctors was they were going to go build a Surgery Center of Oklahoma in Wichita, Kansas. It was going to be the Surgery Center of Wichita or something like that, where it was going to be all cash price, all transparent. And I was helping those docs kind of think through that idea, happily working at the job I was working at previously. And as we talked about the idea of building and running a surgery center, we kind of explored the idea of, well, what about all these other existing surgery centers that do offer cash prices to patients? Most patients don't know that cash prices are available to them, but what if we went and made that more transparent, more available to the general public? So that's where the idea of an online marketplace was born that has now become Fair Market Health. And so I was happily advising these doctors as we were working on Fair Market Health, creating an online marketplace and platform. And what really got me excited and ultimately pulled me into Fair Market Health was I actually had a couple of friends use the service, and I'll tell a quick story. One of my friends, his wife needed a hysterectomy. They were on a medical sharing plan, which I'm an advocate for and which meant they were a cash buyer, right? They didn't have a traditional insurance network, so they needed to go negotiate a cash price. And in the process of doing that, they were told that the hysterectomy that his wife needed was going to be at least $50,000. And my friend's a smart guy, and he said, well, can you be more precise? There's a lot of numbers above $50,000. So can you pick one of those numbers? And they said, no, that's as good as we can get. It's going to be at least $50,000. Now, thankfully, my friend was aware of Fair Market Health, and he called and he said, hey, do you guys offer, hysterectomies on your platform? The answer was yes, with one of the best doctors in town. And he said, okay, well, what's the price, out of curiosity? And we said $7,700. He said, okay, well, that and he had learned enough to know that for a surgery like that, there's an anesthesiologist, a doctor, a facility. He knew there were components to the price, and so he said, okay, that's the doctor's part, but what about all the rest? And we said, no, that's the all-inclusive price. And of course, he was blown away by that. And so they signed up for Fair Market Health, bought the service, all-inclusive price, saving them tens of thousands of dollars. And when they were in talking to the doctor on an unsolicited basis, the doctor began talking to them about how much he loved Fair Market Health. But because for him, it meant he could get paid without fuss and hassle that typically comes with insurance reimbursements. Because when you get paid through insurance, you have to do all the insurance coding and billing, and then chase them for collections for months and weeks and sometimes months. And he understood he didn't need to do any of that with Fair Market Health, that when he completed the service, the money went into his bank account. He didn't need to do anything. And with that story and experience and a couple of others, I thought, you know what, this is what I want to be a part of. And I believe this is the future of healthcare.
Yeah. And I'm with you. And, you mentioned Keith Smith in the Surgery Center of Oklahoma. And I just got to say, I didn't know that there was a connection between Fair Market Health and Surgery Center of Oklahoma, but I'm not surprised. I mean, Dr. Smith at Surgery Center of Oklahoma is a pioneer in free market healthcare, and we owe him all a gratitude.
Completely agree.
As you know, there's these free market surgery centers popping up all over the nation now. One just recently in Indiana, Wellbridge, right?
Yeah.
And I'm sure you're familiar with them, and you're going to probably start putting them on your platform and stuff. And just FYI for our listeners and viewers, which I've already done a social media post about this, not far from me in Moscow, Idaho, there's a surgery center that's going to be popping up in 2023. That's a cash-only surgery center.
Right.
And yeah, I'm so excited. I will tell you what excites me the most is it gives consumers an option. And I will tell you, in places like Moscow, Idaho, or even Spokane, which is a few hours north of them, they're run by big hospital groups, and the consumers don't have an option besides that $50,000 plus hysterectomy. And so it's just nice that consumers have options like they should in any kind of industry. So why shouldn't healthcare be any different, right?
You got it. Yeah. And that's why we spend so much time talking about price transparency. If the consumer wants to choose a $40,000 or $50,000 procedure because that's what they want to do, that maybe that's the doctor they want or the facility they want, absolutely, you should have the option to do that. But if there's a high quality doctor that's going to do the same thing for a fraction of that number, you should have that choice as well. And a lot of that choice comes because people have transparency to make the choice.
Right. And let's just talk about quality. I know you're not an expert in healthcare, but you're sharp enough to know that hysterectomy that was $7,700 versus $50,000, it was done by the same doctor at the same facility, right?
Yep.
I mean, so the quality is no different, right?
Exactly. Well, in fact, what the data shows, and I'm sure you've looked at this and seen this, is both in terms of patient satisfaction and in terms of quality of outcomes, typically outpatient surgery centers can and do outperform hospital settings. And I'm not anti-hospital. We need hospitals. Hospitals are an important part of our community. But the reality is, for many surgeries, in fact, most surgeries, you're actually going to probably have a higher quality outcome and certainly probably have a better experience from a patient standpoint if you choose some of these other options that are available.
Well, and that's just the point when you say choose. Some hospitals are located in areas like my small town, for instance, in Moses Lake, Washington. They're located in an area where patients don't have a lot of choice. And what that does, and I'm not picking on them necessarily, it's just in general with hospitals, what that does is it makes it so they don't have to have the best service, the best quality at the best price, because they don't really have competition.
That's
so the
right.
patient doesn't have a choice. So when patients have choices, just like consumers have choices in the marketplace, you get a better price at a better service and better quality. And speaking of outpatient versus inpatient, hospitals just typically, they're not efficient systems.
Right.
And especially cash surgery centers like Keith Smith, the only reason people will go to them is if they do a good job. There's not a network of insurance companies telling them, well, you've got to go here. And,
right.
And that's another thing that creates inefficiencies in a lot of healthcare is when these insurance companies have preferred networks, they tell the consumer, the patient, where to go. Well, that just automatically creates kind of a monopoly, and they don't have to get good service, right?
That's exactly right. Yeah. In fact, we're bumping into this a little bit as we become bigger, more known in the community. We're not surprisingly getting some pushback from some insurance carriers and insurance provider networks because they want to maintain a closed loop system, right? It's in some sense you could think of it a little bit like they want people to stay in the cult, right? They want people to believe that is the absolutely best and the only way to acquire healthcare. And the reality is, once you've kind of enlightened patients and given them help them see the light of day, they start realizing, oh, well, wait a minute, I can actually go procure these healthcare services at other providers, and the quality and the cost is actually more advantageous to me.
Right. So tell us a little bit about Fair Market Health, and I'll stream the website here, and tell us about how this works.
Yeah, the way I typically describe it to most folks is it's similar to an Amazon or an Airbnb or an Uber, or think of all the marketplace platforms that exist that really at their core exist to help connect buyers and sellers. In the case of Uber, it's connecting drivers with people who need a ride, and in the case of Airbnb, it's connecting people who have rental homes vacation homes that they want to rent with people who are looking for a vacation home to rent. And Amazon, it's connecting people who are looking for a whole host of consumer goods, and with companies that provide those things. Well, that's what Fair Market Health is at the end of the day. It's a marketplace connecting healthcare providers and professionals with patients, with people who need healthcare. And the reality is, 85 to 95% of healthcare is non-emergent, meaning it's something that you need, you have time to plan it, you have time to shop for it. And those are exactly the kinds of services that are available on Fair Market Health. And again, what we strive for is we want our pricing to be all inclusive. So we're trying to avoid people getting surprise bills, right? The environment we all live in today is you buy your healthcare services and then you get to find out the price after the fact. And usually you find out the price in a very confusing and convoluted way. You get all kinds of bills coming to you over usually many weeks or months. You get these explanation of benefits that no one can explain or make any sense of. We eliminate all of that. And in fact, we've had patients who've used Fair Market Health who will buy the service, they get their service, and a few of them will call us back and say, hey, I didn't get any more bills. Yeah, that's the point. You're not
right.
The number you saw was the number you paid, and we're done. And I'm convinced once you've experienced buying healthcare that way, you're not going to want to go back.
I agree with you. And my wife and I, we have a health sharing program that we are part of, and we love it. Just like you said, I recommend it all the time. In fact, I write about it in my book that's called Sickened, How the Government Ruined Healthcare and How to Fix It. And I think one of the fixes is that, consumers have to start shopping and paying for their own healthcare. And, I think insurance has to get out of it, traditional insurance. And one of the fixes would be to use a health sharing program. And they are wonderful because consumers get to pick where they go. The health sharing program doesn't. And when consumers pick, everybody wins. That's not what happens in healthcare. Yeah. So, in my chapter 6, I'd go over a 6-step solution and paying cash for healthcare and actually consumers using health sharing programs is one of the fixes. So you're really, go ahead.
And I have to say all the time, Shawn, I'm not anti-insurance in the sense that people do need catastrophic coverage, right? If you get a cancer diagnosis or you're in a bad car accident, you need catastrophic coverage. Now that can come to you through a traditional insurance product, or it can come to you through a health share. I too am on a health sharing plan, and I also love it and recommend it frequently to people. But the key is, it's catastrophic coverage, and for the daily maintenance and healthcare, those are services that people need to shop for, and ideally do it in a price transparent way.
Well, and like you said, and a lot of people just don't realize this about healthcare. And I think it's partly because the media and the government wants to portray healthcare as it has to be expensive, so somebody else has to pay. And that, most healthcare is emergent. And like you said, 85%. And I think Keith Smith quoted that same thing one time, but also behind that, he said, at least. And if you think about it, most healthcare services are not emergent. And the routine stuff, doctor's visits, regular labs, pharmacy stuff is not expensive. Yep. And it would be a lot less expensive if people paid cash up front. So there's not that middle person involved in it. So
that's exactly right.
You give an example of the hysterectomy that's $7,700, and that's a chunk of change. There's no doubt about it. Mm-hmm. But let's just make a comparison of if you're in a health sharing ministry versus traditional insurance. Traditional insurance for my wife and I is going to be like $1,500 a month. Yeah. We pay $150 a month for our health sharing program now, which means we save $1,200 a month at least, right? Yeah. We could pay for a hysterectomy every year.
Yeah. And have plenty of money left over.
Exactly. And people don't realize what a ripoff, traditional insurance is. You're paying for something you don't really use that much. And if you're getting it from your employer, and I'll have you speak on that because you guys market to employers also. If you're getting it from your employer, the employee is also getting ripped off because that money could go to you in your pocket if the employer wasn't paying $1,500 a month.
You got it. I had a similar situation, Shawn. I had, traditional insurance coverage with my prior employer, who I left to come to Fair Market Health. And for my family of 4, we were paying $1,600 a month. And now with the health share plan that I'm on, same deductible, by the way, I pay $400 a month. So I'm basically paying 1/4 the price, and same thing. I'm saving $1,200 a month, which if my math is right, that's $24,000 a year of savings that stays in my pocket and is available for me to help to buy healthcare.
Yeah, exactly. And then you get to choose what services and where you want to go. That's what's so important. Let's talk about the deductible in health sharing programs. I'm not sure what the program that you're with, but ours, for instance, we have a $5,000 deductible. Yeah. And when we go and have any kind of services, like my son broke his leg 2 years ago, compound fracture, it ended up being $48,000. And there were surprise bills all over the place from the doctor, from radiology, from many different places. And, I'm friends with Dr. Smith, fortunately. And I just said, hey, Dr. Smith, what would it be there, in Oklahoma? He goes, well, hardware and all, it'd be about $8,000.
Wow.
And right. And typically, if you look at these numbers, Dean, kind of like your hysterectomy comparison, and Dr. Smith's the one that educated me on this, it's usually about 8-1. And look at the hysterectomy, 7,000 versus 50,000 plus.
Yeah.
About 8-1.
Yeah.
So anyway, I negotiated a price with the hospital. I negotiated a discount, and any discount I got negotiated was taken off on deductible. So I negotiated a 20% discount. And so it was a $9,000 discount. And so my deductible was $0.
Wow.
And
awesome.
So I paid nothing. And within a week after negotiating, I told him I was all done. Within a week, I had a check in my hand to pay the complete bill off.
Yeah.
They're amazing. Insurance companies do not work like that.
Right.
So tell us how you benefit not just the end consumer, but how you can benefit employers that pay for employees' health care.
Yeah, so we work with mostly self-insured employers, those who have some dollars at risk. It doesn't mean these employers are fully self-insured. Most employers, only the largest employers are fully self-insured. So what self-insured typically means for an employer is they are partially self-insured. And what that more specifically means is they have some kind of a stop loss coverage where they've got what's called a spec and an ag. And what that means really is they care about how much money is being spent on their employees' healthcare, which means that they want their employees to be smart shoppers. And that's really what Fair Market Health does. It helps their employees become smarter shoppers. A lot of our self-insured employers will actually put incentives in place in their health plan to effectively get their employees to first shop on the Fair Market Health platform. And again, the reason the employer wants to do that is it helps create an incentive for the employee that's a win for them, but it also, on the other side, helps create a win for the employer because they're typically the one who have the opportunity to save a lot of money. And what we don't generally come in to try and displace the traditional insurance provider network. So if an employer is with Blue Cross or United or Aetna or Humana or any of the others, we're not trying to completely displace any of those provider networks, because one of the advantages of the insurance carrier networks is they are wide, they are broad. You can typically go to see just about any doctor in your area, walking around with your insurance card. But what most employees don't realize is when you lay that card on the table, many employees think they're getting a discount, that it's a discount card. It's actually just the opposite. When you put that card down, you're typically going to pay among the highest price for the service being acquired. And so what we try to do is, working with employers, is get employees to look first at the cash and transparent price offered on Fair Market Health, because that's a great starting place for understanding what is the true cost of the service that the employee needs.
Yeah, I like that analogy, Dean. Even though I know the concept, I never thought about it before, but you're right. Employees think when they put that insurance card down, I've got good insurance, I'm getting a good discount. And in reality, they're getting overcharged. Thank you for that, because that's very important. And I have never used that analogy to talk about how health insurance is a ripoff, but that's a really good analogy. It's not a discount card. It's actually a card that's going to say you're getting charged more. Yeah.
Well, and one of the other great things that comes with a platform like Fair Market Health is you are actually re-educating your employees about what is the true cost of healthcare. Because when you're walking around with that card, it's kind of like you're walking around with your employer's checkbook, right? And what what other part of a business would you allow your employees to walk around with your checkbook? I mean, if somebody in your employee came back and said, well, I purchased this thing, and you'd reasonably say, well, what did it cost? And if they said they don't know, they just bought something on the company dime, but they don't know what it costs, you'd probably fire them on the spot.
Right.
But for some reason in healthcare, everybody's fine with letting every employee effectively walk around with the employer's checkbook, buying things that no one knows the price of. It's incredible.
I did a great video, and being a guest on our podcast, you'll get a copy of it emailed to you. But I did a great video on what if auto insurance worked like health insurance. And, you talk about catastrophic coverage for health insurance, and that's originally how it started. It's like, okay, you get cancer and, you got some kind of coverage. But, now it covers your routine doctor visit, just for health, for physical and everything in between. And just think about if auto insurance worked that way. Initially, your employer pays for your insurance, and you wreck your car and you're like super happy because, wow, I don't have to pay for my wrecked car. But next thing you know, you're getting tires in your car and you're mad because your employer's auto insurance should cover it.
Right.
And next thing you know, you're putting gas in your car. And it's like, you know what? I shouldn't have to pay for this. Yeah. But then what happens? Prices, all those things go up, and we think we're getting a discount when in reality the consumers are getting ripped off.
You got it.
So, and the transparent. Imagine if you checked into a hotel and they didn't know the price of it. You wouldn't check in,
right?
But we do it all the time in healthcare. Well, like you say with a hysterectomy, well, it's going to be, at least $50,000. If a hotel told us that, we'd walk out. Yep. We go somewhere else, but we accept it in healthcare. But that's one of the reasons I like to get the word out with people like you, because we don't have to accept it, and consumers need to know that.
That's right. That's exactly right.
So backing up a little bit, when we talk about, you were comparing fair market health or just healthcare in general, the industry, you compared it to Amazon, you compared it to Airbnbs. Now, there's some people out there, and I'm putting you on the spot, Dean. There's some people out there that say, well, you can't compare. They're different. You can't compare healthcare to Amazon or to an Airbnb. Tell us why they're not different.
Well, again, at the end of the day, and this is an important point for your listeners, at Fair Market Health, we actually don't negotiate prices with healthcare providers, which is a very different model than the insurance model. The insurance model pays all doctors the same. So if you're a ear, nose, and throat doctor and you're going to do a tonsillectomy, you're going to get paid the same as every other doctor in town. They don't, they negotiate a price with you, but they don't really give you as the doctor a lot of say in what you're going to be in reverse. Well, how do you feel about that if you're the best doctor in town? You don't really love that model. And that's one of the reasons doctors like what we do is we actually don't tell them what they're worth. And what we tell them is, we don't need to tell you what you're worth. The market will ultimately determine what you're worth. If you're the best surgeon in town, knee surgeon or heart surgeon or whatever, I want you to be paid the most. You deserve to be paid the most. If your reputation is such that you can justify an extra $500 to $1,000 for performing a complicated surgery, I want you to earn that and have that option. And so our model is very much set up in the spirit of free markets, where doctors get to decide what they want to be paid, and then consumers get to decide whether they value the service that's being provided at the price at which it is being offered. And so when you come onto our site, very similar to, one of the things I love about Amazon, even if I don't always buy things off of Amazon, one of the things I do is I come look at the products. It's got all the price comparisons and it's got the reviews, and I use the tools to help make myself a more informed consumer. Same thing with Airbnb. Maybe I need a 3-bedroom house to rent, or maybe I only need a 2-bedroom, or maybe I want a pool, maybe I don't want a pool. The choice is in the hands of the consumer, and that's what we're trying to build or have built with Fair Market Health is we want consumers to have the choice. So if you look for services on our platform, you will notice that the prices are different because doctors are deciding what they want to charge for services. And we are perfectly happy to let those price differences exist because we believe consumers are smart enough and should have the choice. We don't need to tell doctors what they're worth.
Absolutely. I love it. And ultimately, when consumers choose, everybody wins.
Yep. And we tell doctors all the time, you pick the price that you want to charge. And if you want to increase your price or lower your price, you're free to do that at any time. We give the doctors full ability and access to change their prices, add, subtract services. Again, it's a marketplace. I think of it as the farmer's market. Come and offer whatever fruits and vegetables you want, price it as you want. The shoppers, as they come, will ultimately determine if what you're offering is a fair and reasonable price.
Yeah, for sure. So I'm assuming next week you're going to be at the Free Market Medical Association.
I'm not making it this year because I have a different conflict that I'm headed to, but I'm actually sad about that because I was there last year and it really is a great conference. So are you going to be there?
Yes, we are.
Jeez.
I'd love to meet you there. For those of you listening and viewing, you've heard me talk about the Free Market Medical Association before, but there's an annual conference next week in Dallas, and we will be there, and we get to network with a lot of people like Dean and just other people that believe in free markets and healthcare. And it's just a great opportunity to show a growing industry because some people are still a little bit skeptical about it. But it's a big growing thing. There are doctors, there are surgery centers, there are, pharmacies like myself that just, are changing the marketplace and consumers are benefiting. So I really want to get the word out.
You bet. It's a great conference.
So right now, Dean, you started out in the Kansas City area, correct?
That's right. Yeah, Wichita specifically, which is where I'm based. We're now also in Kansas City and in several Kansas towns in between, and then we'll very soon, within months, be expanding into some adjacent geographies. Missouri, Arkansas, Oklahoma City, Texas, Colorado. We've got lots of plans to grow. We're thankfully getting lots of employers who are calling us up saying, hey, we want what you're doing in our market. And, when I go to doctors and say, hey, I've got employers and patients who are looking to, shop and bring you and pay you cash for your services, it's easy to get doctors signed up because for doctors to list on our platform, it costs them nothing. So what I tell doctors is this is zero downside and all upside. How'd you like more cash paying patients? And how'd you like to get paid immediately with no coding, billing, collections? And again, there's no cost for doctors to list services. So why wouldn't you do this?
Right. It's almost too good to be true, but that's in a free market. That's really what happens is both sides benefit.
That's right.
It's transactional. So Dean, what do you have a passion for?
To me, this is all about changing the healthcare paradigm and in the U.S. And what I believe, and I think Shawn, you and probably many of your listeners believe, is healthcare actually is not that expensive. We've been made to believe that it is, but when you pay cash prices and pay them transparently, most people will discover that the healthcare itself is not that expensive. It's this insurance burden that's been laid on top of us. And so at the end of the day, I just like healthcare to be, more affordable. And when it's more affordable, it becomes more accessible, right? This idea that people are deferring needed healthcare because they just don't believe they can burden or stomach the burden of the cost. We actually have I'll tell a quick story. We actually had an employer that we were working with, and at the enrollment meeting, we were explaining fair market health, and their employer was actually had run the program so that if an employee could find the service on Fair Market Health, they would waive the deductibles and any coinsurance, which was typical in their health plan design. But because the employer saw the savings that were available, they, as an incentive, they said, we'll waive your deductible and your coinsurance if you find it on Fair Market Health. Well, this older gentleman, I'd say probably in his late 50s, came kind of hobbling up to our table at the enrollment meeting, and he said, so let me get this straight. If I needed a knee replacement, which he did, he said I could get this for free. My employer will cover the deductible and coinsurance. And we said, yeah, that's right. And he started tearing up, actually, because he went on to tell us he'd been waiting 3 years for a knee replacement surgery that he knew was going to cost, under traditional insurance, it was going to cost $50,000 in total. And based on his deductible and his coinsurance, that was going to cost him personally $15,000. And now on our platform, you can get a knee replacement for $22,000, and the employer was going to cover all of that. And that gentleman has now since had his knee replacement. And what a great win-win. He ended up getting a needed knee replacement, cost him nothing, and his employer paid the $22,000 bill and effectively saved themselves, in round math, $15,000.
Right. And there's, Dean, there's lots of stories like that. As you know, people, coverage doesn't equal care in the traditional insurance model. And there are so many people that they have this coverage, but the deductibles are so high and the coinsurances are so high, they literally can't afford it. That's so, right. Your example is well taken. There's a lot of those like that, but paying cash will change that marketplace. So,
you got it.
So Dean, what is the best way to get a hold of you if anybody has any questions?
They're welcome to reach me via email, and it's simply dean@fairmarkethealth.com. That's probably the best way to reach me, or you can reach me through our website. You'll see a number. Shawn's got it up now. You'll see a number in the upper right corner there. One of the things we're proud of is, and this is a question we get from clients or future clients, is, well, you're running a tech platform, but can I talk to a real live human being? And so we put a number right there on our website. The web chat that is down on the lower right, those faces are real life people who work at Fair Market Health. They're all based here in the U.S. And they're all great and will help you from a customer service standpoint. So you can reach me through either of those channels, but feel free to email me at dean@fairmarkethealth.com.
Dean, I love what you're doing. Thank you so much. The reality of it is the government is not going to fix the healthcare system. The government is the one that ruined it. So we have to look to consumers to fix it, like with any other marketplace. And people like yourself are helping to educate and empower consumers to take charge of their own health. Yeah. And not just physically take charge of their own health, but financially. That's a very important part of it. That's part of what happens in a transactional free market, is that, there has to be a free exchange of goods and services. So the consumer has to pay for it. So thank you, Dean, for helping us realize our goal today. I really, really appreciate it.
Yeah, thanks for the opportunity and enjoyed the discussion.
You're welcome. So listeners and viewers, tune in, because Monday Janet and I will be discussing what's coming up at the Free Market Medical Association annual conference, because we will be there as a vendor and be meeting lots of cool people. So stay tuned, because we're hoping to meet lots of cool people and celebrities. I hope, I did a little video a couple weeks ago on Kennedy, and Kennedy is going to be speaking there, and she is a big believer in fair markets. And Kennedy was my crush in college when she was an MTV VJ. So I'm hoping to meet her. So stay tuned for that. Janet and I will be kind of updating you on the show throughout the week. And we really appreciate everybody listening and viewing. You can catch us here on my Facebook page, the Moses Lake Professional Pharmacy YouTube site. Check us out, subscribe, and we really appreciate it. Thank you for listening to Health Solutions with Shawn and Janet Needham.